Welcome to the University of Health and Allied Sciences, UHAS, located at Sokode Lokwe in the whole municipality. UHAS started operations in September 2012 and is the first public university established in the Volta region of Ghana.
My name is Professor Lydia Aziato. I took office as the Vice Chancellor for the University of Health and Allied Sciences in August 2022. And the university in 2012 started with 154 students. But a law that established UHAS and UNAIR, the university in Sunyani, was passed in 2011. And the dream of UHAS was birthed by our late president, Professor John Evans Atta Mills. The university at its inception used facilities in the teaching hospital, and some schools are still occupying these incubating facilities in the teaching hospital. We want to appreciate the Regional Coordinating Council and all the chiefs and stakeholders that helped to initiate or start this university here in the Volta region. We have since grown. Now our student population is almost 9,000. However, we do not have enough accommodation for the students, so we can only accommodate just about 2,000 students, which is woefully inadequate. The university currently operates from Ho and Hohoi. We operate multiple campuses, and that gives a lot of challenges in terms of our ICT and other commuting and running costs, because the roads too are not very good.
So the university, as you know, was established by an Act of Parliament, Act 828, 2011, as a public university. And we are a specialized university training health and allied professionals for the country. The university has a governing council currently chaired by Justice Victor Maulam Doche. It has other members. The university also has a strategic plan which was approved by the University Council in 2017 up to 2027. The university has other policy instruments that governs its administration. As the Chief Operating Officer of the university, I'm responsible for the day-to-day activities and operations of the university, ensuring that processes and procedures in the university follow the policy instruments from the Act, the statute, and other policies approved by the University Council. I ensure that student affairs, student activities, and every other operations in the university run smoothly in accordance with these policy instruments.
So I joined the university in 2015. At that time, the first phase of the Ghana-China Collaboration for UHAS had already been implemented. That we refer to it as the China Phase 1. It was implemented in the year 2013, and then they completed 2015 thereabouts. And that comprises of the School of Basic and Biomedical Sciences. And the teaching block, the library block, the auditorium, and then the canteen were all part of the scope of works. It also included a 68-bed capacity hostel for the students, and then 8 two-bedroom bungalows for staff. 2019, during Prof. Japon's tenure, the China UHAS Collaboration Phase 2 also started. We proposed 4 projects, that is the Central Administration, School of Nursing and Midwifery, the ICT and Library Block, and the Institute of Health and Research. However, for a cost of 60 million USD, the Chinese granted us the Central Administration Block and the School of Nursing and Midwifery, fully furnished, fully equipped with the biggest simulation center in the whole of Ghana, and I dare say the whole of West Africa. It's been a very beautiful project is turned out very nice and very iconic, I must say. And I think that it is the best administration block for any university in Ghana. So UHAS, a quiet, gentle giant, is rising to the horizon.
UHAS, it is the only state university wholly dedicated to the training of healthcare professionals in the country. The university currently runs 25 undergraduate programs and 25 postgraduate programs in 7 schools and 2 institutes.
The university is spread across 2 main town campuses. There's a campus here in Ho and a campus in Hohwe. The whole campus is subdivided into our south campus at Dave, our north campus at the Ho Teaching Hospital, and the main campus here at Sokode Etwe. We run a total of some 25 undergraduate programs. Of these 25, 3 are very new. The Doctor of Medical Laboratory Science program is coming on stream in this current admission we are doing for the next academic year, which will replace the Medical Laboratory Science Bachelor Degree program. We are also introducing a 6 years Doctor of Psychology program with specializations in clinical psychology, counseling psychology, and neuropsychology. This year, we are also introducing the Bachelor of Health Services Administration program. This program is our effort at achieving the university's vision and mission, which is to contribute to health delivery in Ghana and beyond. We also have 25 postgraduate programs, 17 of which are master's level programs made up of MScs, MPhils, and Masters of Public Health, and 8 are PhD programs. We also make the effort to provide continuing education for health professionals. And so we have the Sandwich program, which involves a good blend of online learning where it is possible, even though this is limited because of the nature of courses we run, and face-to-face program. Our hallmark, our flagship program as a university, which differentiates it from all the other universities, is our compulsory vocational training 3rd semester program, which enables the student to be placed in industry right from first year through to the completion of the program to prepare them for the world of work.
UHAS currently operates 8 schools and 2 institutes. These are the School of Medicine, School of Dentistry, Fred Newton Binker School of Public Health, the School of Pharmacy, the School of Basic and Biomedical Sciences, School of Nursing and Midwifery, School of Sports and Exercise Medicine, and School of Allied Health Sciences. These schools have varied programs, all in health and related professions. We have the School of Medicine running 2 programs, the MBCHB, and then the Physician Assistant. The School of Pharmacy runs the Doctor of Pharmacy program, a 6-year program. The School of Sports and Exercise Medicine run a degree program in Sports and Exercise Medicine, and many others. Now, these schools are headed by deans of various professional backgrounds. Our Institute of Health Research conducts research in various health topics.
So this is our skills lab and part of the stimulation complex. And then what we basically do here is to train our students in nursing skills. So with the Department of Nursing, at the level 100, we take them through basic nursing, 200 advanced nursing, 3 and 4 advanced nursing. So what we do is we teach the theory. Students come to the skills lab during the week. Each level has his turn to have their turn for the skills. So based on what they have taught in the classroom, we train them with the skills. The same thing to happen to the midwifery. During their level 100, they do basic nursing. Level 200, they do advanced nursing. 300, they focus on the midwifery specific practicals. So what we do after we train them in the skills lab, we go now move to the community with the public health, move to the clinical sites, that's the hospitals, with the nursing and midwifery students. So that's what we do, just to enhance our skills, so that our students will come out very perfect, efficient for the job market. One advantage at the School of Nursing and Midwifery of the UHAS, University of Health and Allied Sciences, is that we pay much attention to our practicals. We want our students to be well equipped for the job market.
In accordance with the exchange of notes signed on 11th January 2019 by the Government of the People's Republic of China and the Government of the Republic of Ghana, the Government of the People's Republic of China agreed to undertake the China-aided Phase 2 project of UHAS in Ho.
China Phase 2 projects is one of the, shall I say, a game changer for the university, because it's giving us an additional 2,500 student spaces. And because we are going to introduce new programs and also increase the intake of the existing programs, I'm sure that the university is growing from strength to strength.
So the simulation lab that the Chinese government built for us, it's about 9,000 square meters in area. It's coming fully equipped with about 172 computers for an e-library, and then a hard library or traditional library as we know it. It also comes giving the students a full experience from the outpatients department through surgery to ICU and then to pharmacy. UHAS has been very blessed to have all our mannequins fitted, all our anesthesia machines fitted, all our surgical instruments and surgical rooms fitted as it should be in a hospital. Central administration is a total of 9,000 square meters in area, and it houses all the directorates of the university, apart from the works directorate, but it also comes very fully equipped and furnished. We have a number of meeting rooms because the university system is based on several committee works. The teaching block that the Chinese government built for us seats 2,500 students, and that also covers an area of approximately 6,000 square meters. All in all, compared to what we had in Phase 1, Phase 1 had about 10,000 square meters in total. Over here we have 29,200 square meters in total. Phase 1 was approximately 20 million USD in cost, and this one is 60 million USD in cost. So UHAS has been blessed to have the second phase of the Chinese collaboration with Ghana. We thank all the governments that have pushed this through. We thank all our vice chancellors that have pushed this through, and we are hoping for a third phase of the Ghana-China collaboration.
On behalf of council management and the university student staff, all of us here want to appreciate the People's Republic of China for coming through to help us in terms of our infrastructural needs. And we are hoping that they'll continue to support us to grow the university. One of the key things that I'm praying that we get is the staff and student accommodation, as well as a medical center for the university.
Student life on the University of Health and Allied Sciences UHAS campus is vibrant and enriching, characterized by a dynamic blend of academic rigor and extracurricular activities.
Generally, student life on campus has been a fantastic experience, and the SRC has played an instrumental role in ensuring that happens. On campus, for a very long time on campus, we've had a very peaceful coexistence with students on campus and also management alike. Even though with management, there are many instances or there are moments that we as SRC has mounted advocacy on behalf of students. But even in all that, generally, we've had a wonderful experience with them. Another thing that's worth mentioning is the method of our training on campus. which is more practically oriented with massive community engagement. In the course of our training, as part of our classroom experiences, we are sent into the communities as vocational training, where we have some sort of engagement with the various health facilities in the communities as part of our vocational training, and that takes an incredible amount of time. And through that, we've had positive remarks from even the nearby hospitals and also from visiting lecturers who come to teach us on campus here.
Our lectures are quite inspiring and welcoming. The institution is aimed at setting the new generation of health professionals, and it gives theoretical and innovative skills. So tell a friend to tell a friend if the individual is looking for an institution that aims at providing professional training to individuals. UHAS welcomes you.
University of Health and Allied Science has the best infrastructure and amazing lectures.
Over the years, we've been able to attract very, very top-ranked professors from across the nation and internationally to the university. Our staff are also doing very, very well. In terms of research, the university in the area of health research is rated #1 in the country. And we also have our students who are performing very, very well in Ghana. And our alumni are also doing tremendously well across the world.
I'm pleased to announce some of the successes the university has chalked over our young lives. We are only 12 years old, and we have chalked so many successes, among which are the university becoming first in the SDG 3. Also, the university student, one of our own from the School of Pharmacy, was adjudged the national best in their licentiate examinations. We also got one of our students from the nursing and midwifery becoming the overall national best in midwifery following their licensing exams. Again, the School of Nursing and Midwifery produced the overall national best student in nursing following their licentiate examinations. These are among many other successes the university has chalked over this period.
In the near future, what are we looking at? We are looking at a university that is dominant in the health space. We are looking at a university that is going to lead in various areas in health, especially in the area of cancer or oncology, in the area of mental health, in the area of health technology, in the area of health informatics. We are collaborating with other sister universities across the world. We have now almost 60 plus active collaborations across the world. And we are sure that with these collaborations, UHAS is going to grow from strength to strength. As the Vice Chancellor of the university, I want to assure parents, prospective students, that UHAS is the best place to train as a health professionals. I also want to assure our stakeholders that together we work with you to grow this university.
University of Health and Allied Sciences, UHAS. Health for Development.